Welcome to our poster presentation. The work reflected here today is from an interdisciplinary team who worked with a number of students from Kent State University to study the impact of COVID and its implications very early in the 2020 pandemic. Remember that at that time, students were pivoting quickly to respond to a number of issues that had changed on campus. We had very few answers that were coming forward and a tremendous amount of public health information. At that time, a very seasoned research team with Drs. Hughes, Wolverton, Vanderhorst, and Gibson applied what they knew about the Ebola epidemic to assist us in studying the pandemic. At this time, we were able to look at the specific needs of nursing students and compare them to undergraduate students in non-health related areas of study. With that being said, Jasmine Bonder joins us again. Jasmine is known to Tana. She presented in 2019 and she's currently faculty at Kent State University, as well as a researcher on this study and a DNP student. Jasmine, can you lead us through the purpose of the study?
Yes, thank you, Dr. Cleveland. The purpose of the study is to understand the impact that COVID-19 had on undergraduate nursing students' anxiety and resilience in early March 2020, and what they did to keep themselves safe compared to alike undergraduate students in non-healthcare related majors. With the amount of challenges nursing students were faced at the time, such as clinical restrictions or being removed from clinical sites, being asked to social distance and change their learning methods to remote learning, it brought a lot of challenges to their everyday routine. After we received IRB approval, 3 surveys were deployed to all Kent State University students enrolled at the time. The first survey was sent out at the beginning of March, the second one was at the middle of March, and then the third one was in April. Our study was both a qualitative and quantitative study where our focus was to compare anxiety and resilience in the undergraduate nursing students to the undergraduate students and to analyze what type of avoidance behavior did they use to keep themselves safe at the time at the beginning of the pandemic in March 2020.
Thank you. Katie Pijak is a junior nursing student at Kent State, and she will address the specific hypotheses that emerged from our purpose.
So when we were forming our hypotheses, we took into consideration that the campus had just been shut down and everyone was sent home, and we came up with several hypotheses looking at undergraduate nursing students compared to undergraduate non-health related major students. First off, we anticipated that undergraduate nursing students would have higher anxiety and resilience levels. We also predicted that undergraduate nursing students would have higher self-reported avoidance behaviors, higher perceived knowledge of the novel coronavirus, and report a greater perceived risk of contracting COVID compared to our undergraduate non-health related major students. And lastly, our hypothesis for our qualitative data looked at all undergraduate students to see what they felt was important enough to add at the end of the survey regarding their anxiety and resilience in the early COVID pandemic.
Thank you. Kate Kennedy is a junior nursing student at Kent, and Kate is going to walk us through the methods.
Our methods were constructed around assuring a robust sampling size because our main priority of doing this study was to see how this pandemic would affect nursing students, and more importantly, how it would affect the retention of nursing students and keeping nursing students in school. So in mid-March of 2020, Kent State students were getting lots of emails from the university regarding the emergence of the pandemic, and one of the emails sent out was a survey regarding students' feelings about the brewing pandemic. Nearly 31,000 students were surveyed, and about 5,500 valid responses were obtained. For our study regarding nursing students, we had a sample size of 414 nursing students that was matched with randomly selected non-nursing undergraduate students. So our total sample size for this study was 828. So we got a great sample size and we had great comparison population of non-nursing undergraduate students to match against the nursing students. And because of this, we had a lot of great data that we got to put together to get our results. And for the qualitative data analysis, we ended up using thematic analysis that involved reading through our data set from our open-ended questions that were sent in the survey.
In the quantitative arm of our study, our team found that undergraduate nursing students had a higher perceived risk of contracting COVID. That surprised us because we did not expect this finding when learning that undergraduate nursing students had less anxiety than non-health related majors. Now to lead us through the rest of the quantitative findings regarding avoidance behaviors is Abby Stankert, who is also a junior nursing student at Kent State University.
Hi, so I will be discussing the results of the use of avoidance behaviors between nursing students and other non-health majors. Unexpectedly, undergraduate nursing students reported lower anxiety than undergraduate non-health majors, but there was no relationship found between our independent variables, which were the program of study and the use of 4 key avoidance behaviors. Specifically, we looked at hand washing, the use of hand sanitizer, wearing a mask, and avoiding large crowds. Based on the chi-square analysis, the p-value for all 4 behaviors was above 0.05, meaning the results did not show a significant difference between the 2 groups being compared. Therefore, we cannot conclude that taking part in avoidance behaviors would negatively impact anxiety. These results can be visualized in the graph on our poster. In this graph, we compared the percentage of each population that reported engaging in each specific avoidance behavior. As you can see, there was very little difference between the nursing students and non-health major students. You may notice the very low percentage of students who reported wearing a mask. We have to keep in mind that this survey was conducted in March of 2020 before the CDC recommended wearing a mask in public. We did not have the same guidance on the use of avoidance behaviors in March of 2020 that we do today. These results show that all Kent State students, no matter their major, were actually adhering to the public health recommendations at high rates. Even though undergraduate nursing students reported that they had less anxiety, the results show that no matter their anxiety level, they used the same avoidance behaviors, and we believe this is a testament to the students at Kent State following closely to the public health messaging at this time.
Hannah Cull is a junior nursing student at Kent State, and she worked with Katie Pijak on analyzing our qualitative findings. Hannah, can you please walk us through the qualitative arm of the study?
So, using the responses we received in the survey from as soon as the pandemic started, which included both undergraduate nursing students and all non-related health majors, we were able to use an open coding analysis and come up with 3 overarching themes that surrounded the perceptions of increased anxiety and resilience. Those being 1, the ability to process information and experiences as necessary for students to effectively respond to the pandemic. 2, disruption in daily routines coupled with increasing responsibilities are important in managing uncertainty. And 3, external factors control whether the virus is spread or contracted, in addition to personal behaviors. Using our responses, we went back through the data and chose statements that best supported our 3 themes. And the theme that consisted of the most responses was the disruption in daily routines. For our second phase of the study, we want to focus on these 3 themes and how they will still relate to our follow-up survey next month and just understand the new or same perceptions that these students may have.
Thank you, Hannah. If we're going to have a nursing workforce that's large enough for us to meet the needs of all of our patients, we have to make sure we're retaining our nursing students. To that end, it's important that we look at and determine whether or not our lower nursing student anxiety and higher resilience findings are sustained. As this research continues into phase 2 of our study, we are going to be cognizant as policymakers, educators, and nurses who provide for the legal needs of nurses that policies are in accord with the Future of Nursing Report 2020 to ensure that a healthy nursing workforce is maintained. As educators, we have to make sure that we are supporting curricular enhancement to assist our nursing students in identifying the value of the profession that they are in, while assuring that we are bringing nimble and creative teaching strategies such as simulation to the experiences that they have in the classroom. Finally, as regulators, we need to consider promulgating regulations that strive for the goals of the Future of Nursing 2020 to 2030 report. By maintaining a healthy workforce, we will be able to maintain our students as well. We also must look to regulations that assure proper PPE provisions, as well as research to support treatment of active and long COVID. We cannot forget that there are also many debates going on now about the importance of the role of vaccination in the healthcare workforce. We're looking forward to the next phase of our research. We'd like to thank you for your time, and we look forward to any questions that you may have. Our reference page is also available to you, and if you have questions, you may reach out to me at kthoma43@kent.edu, and that information is provided in the handout for our presentation.